welcome to our newest stream. And this one is very important because we are going to get the skinny on the use or the proper use of antibiotics. Now, we've all used antibiotics and we may not know what exactly they are and how exactly they work and why the proper use is important. So, Dr. Ravi Tripathi is with me today and Dr. Dave Rohini, and they are going to give us the skinny on the proper use of antibiotics. Welcome, Dr. Tripathi and Dr. Rohini. Thank you for joining our stream today. So I guess we should start off with what exactly is an antibiotic?
Yeah, that's a great question. So an antibiotic is a class of medication that targets a bacteria, which is a type of germ that can cause infections. So you might have heard of penicillins, which was one of our earliest antibiotics. And since its discovery, we have a ton of antibiotics that we can use to treat infections caused by bacteria. Infections can also be caused by viruses, which is another type of germ. And viruses are things like influenza, RSV, or COVID. It's really important to note that antibiotics like penicillin are not going to cover viral infections. So they're really only going to cover bacterial infections.
Well, that's good to know. So if antibiotics work only for bacterial infections, then all those people who call the doctor saying they have a cold and want an antibiotic. So what do you have to say to that?
Yeah, that's a great question. And given that it's the fall and getting colder, and it's what we call viral respiratory season, where everyone gets colds, everyone has runny nose. I have 2 kids in daycare, and they come home with a cough constantly. It's good to know kind of what's causing things and what will help you feel better. That's the most important thing. So if in most cases, when people have kind of these respiratory symptoms like a cough, a runny nose, that is most of the time, probably close to 90+% of the time, caused by a virus. And these viruses are spread from one person to another, usually through coughing or sneezing or kind of through what we touch. Those unfortunately will not be treated by an antibiotic, and an antibiotic will not make you feel better. So lots of times when you go to the doctor, what they can do is provide other symptom relief, like decongestants or cough suppressants that can try to help you make your symptoms feel better. In the kind of more rare circumstances, in that probably kind of less than 10% category, where your symptoms are caused by a bacteria, then an antibiotic can help you feel better faster. And that's where a doctor can help kind of make sure you get the right antibiotic and get you that medication that will help improve your symptoms.
So how can we tell, number one, which antibiotic or which germ is causing discomfort and the difference between a virus and a bacterial? So how does one distinguish between a bacterial infection and a viral infection?
Yeah, that's a great question. And that's something that we as doctors ask ourselves constantly when we're assessing a patient. And we don't always get it right. I think there are certain things that we look for that kind of make us think that it's more likely being like a pneumonia caused by a bacteria. Such things as, kind of high fevers, coughs that are very productive of things, feeling very short of breath, lots of times movement. We, in the office can do things like check your oxygen levels to see if they're dipping, which is suggestive of a bacterial infection. And then sometimes we might even go as far as getting a chest X-ray or something like that, where we can take another, look at kind of what's going on in your lungs. Most of the time, though, it will be a doctor asking questions to try to figure it out. You at home, kind of when you're feeling a little bit under the weather and feeling sick, you can kind of ask yourself, if someone around me is sick also, and I think I caught something from them, that makes it more likely to be a virus. And if it's been going on for a couple days, and it's associated with runny nose, big things that you can do, it's more likely to be a virus. And big things you can do is try to keep yourself hydrated, get lots of rest. And if you feel like you're not getting better, or there's a shortness of breath that is really limiting your activities, that's when it's probably a good idea to go ahead and get checked out.
So there's people who may not be as savvy as others and knowing the difference between bacterial and viral infections, and who want that antibiotic anyway. Can you talk about some of the adverse effects that come from taking an antibiotic when you actually have a viral infection, like a pneumonia or a COVID or a cold?
Yeah, sure. So, like any other medication, there are harms to taking antibiotics. So, antibiotics can affect, depending on which antibiotic you're prescribed, they may affect your heart, they could affect your liver, they could affect your kidneys. Something we often see is something called antibiotic associated diarrhea. So, what happens is as we take antibiotics, it changes the normal bacteria that are in our gut, and a bacteria called C. difficile can overgrow and cause some pretty significant diarrhea and sometimes can cause hospitalization. So that's something we try to avoid by avoiding unnecessary use of antibiotics. In addition to that, you can have some allergic reactions to antibiotic. Now, this could be a mild rash, mild hives, or you can have difficulty breathing. So it's really important to tell your doctor if you have any allergies to antibiotics. And then finally, one of the consequences of antibiotics is the emergence of resistance. So you might hear on the news superbugs. So bacteria become smart and they develop ways to overcome the antibiotics that we are prescribing. So because of that, we really want to try to only use antibiotics when they're needed.
Those super bugs could be kind of scary. And I know that C. diff, I think it's called C. difficile, can be contagious. So how does that work? How does that bacteria spread? I mean, if how do you treat a bacteria that's overgrown when a bacteria is causing the problem? Is, I guess, my question.
Yeah, that's a great question. So there are antibiotics that can treat that bug called C. difficile specifically. So we'll prescribe that to patients who who have this C. difficile infection, and then it spreads through something called spores. So it can be on surfaces. So it's really important if you're caring for a patient with C. difficile or you have C. difficile that you wash your hands with soap and water.
I suspect that hand washing with soap and water can actually alleviate or diminish many of the bacteria infections. So perhaps the first line of defense is proper hand washing. So, what is antimicrobial stewardship? I mean, we're talking about antibiotics and using them properly and correctly, good stewardship, just like people have good stewardship of monies and stuff like that. So, can you talk about how humans, doctors and patients, can exercise good stewardship of antibiotics?
Yeah, that's a great question, and we are so happy to kind of be here and be able to talk about it. So Rohini and myself are two of the members of what we call the Antimicrobial Stewardship Program here at the VA Maryland Healthcare System. And actually, in the U.S., all hospitals have some sort of stewardship program, and that's partly because it's mandated by the government, but partly because it's a good way to try to keep track of our antibiotics and keep an eye on them. So what our jobs are here kind of at the VA is we oversee kind of all of the antibiotic prescribing that happens throughout the VA Maryland healthcare system to try to help providers, those people who are giving the prescriptions, make sure that they're picking the correct antibiotics, because of matched with the right indication. They're giving the right doses. We're making sure that our antibiotics are not going to interact with any of the other medications that patients are taking. And kind of we also kind of create guidelines and provide guidance about what the best antibiotics, the most effective antibiotics for the infections that we see here, mostly in Baltimore and throughout Maryland see. And so we get to work together. I find this work very rewarding. So I'm a doctor by training, Rohini being our pharmacist by training. We get to work together to kind of try to move around and kind of assist, those throughout the system that are prescribing those, that are diagnosing infections and prescribing those antibiotics.
So let's get back to how do you actually differentiate, so that people who watch, how do you differentiate between bacteria or germs so that you know which antibiotic to actually prescribe?
Yeah, that's a great question. And most of what we've talked about so far has been kind of pneumonias or respiratory infections. But as I'm sure people are aware, we can get infections of all different parts of the body. Whether it be urinary tract infections, you can get gallbladder infections called cholecystitis or appendicitis, and all types of different things. So one of the things that we look at is kind of where in the body we're concerned about, the infection. And that's why, a doctor will kind of always ask a whole bunch of questions, starting with, are you having fevers and chills, to usually more specific questions of, are you having shortness of breath, or does your belly hurt, or are you nauseous or vomiting? Because those help us narrow down where in the body we're most worried about infection. And then once we kind of have an area that we're most worried about, we start putting a list together in our head of what's the most likely cause. Is this going to be, the flu virus? Or for someone who's nauseous and vomiting, is this a what we call a virus that can cause gastroenteritis or irritation of the GI tract? Or is there a bacteria sitting in there that's probably causing kind of this infection? Lots of times, depending on where the infection is, we might, need to order more tests, whether that be blood work or checking kind of a sputum sample, or a stool sample in some circumstances, or get imaging like chest x-rays or CAT scans. All of that helps us kind of narrow down what the cause of what we're treating is. And then lots of times, once we have we're kind of making our best guess by putting all of this information together, that'll help us, get down to the point of, okay, we're gonna, treat this with an antibiotic, or we don't think we need an antibiotic. And then in terms of picking the antibiotic, we have lots of different recommendations based on where in the body we think the infection is, knowing kind of what bacteria commonly cause infections in those areas of the body. And that's where kind of our stewardship program helps the doctors kind of figure out, in the gut, you should be worried about these bacteria, but in the lungs, you can be worried about these bacteria.
So, since you talked about how bacteria can sort of kill good bacteria, like there's obviously good and bad bacteria in our bodies. For instance, if people are being prescribed antibiotics, should they increase the pre and probiotics that they take in order to counteract, or is that, is that a thing?
Great question, Rohini. Do you want to tackle that, or do you want me to?
Yeah, so it depends. I would say always talk to your doctor before, changing something or taking something new. But in some cases, probiotics might help restore some of that normal bacteria that's in your gut. But again, always talk to your doctor before starting something new.
Okay. Is there anything that I did not ask you that your patients ask you all the time about antibiotics? I know that antibiotics have to be taken on a schedule. What happens if you miss one of those dosages? Like, let's say you're supposed to take it in the morning, at night. You go home from work and everything's really busy and you completely forget. So then what happens in that case? Do you double up the next day, or do you take it when you remember it? How does that work?
Yeah, I would say if it's close to your scheduled time, go ahead and take it. If you're really close to your next dose, don't double up. Just go back to your normal schedule. The other thing I like to tell patients is take it as prescribed. So take it for the duration it's prescribed to you and the number of times a day it's prescribed to you. If you have any antibiotics left over from a previous infection you might have had, don't use that for, in the future. So dispose of it. There's a lot of pharmacies that have drug take-back bins in their waiting area, so you can dispose of old antibiotics there. So don't use old antibiotics that were prescribed to you, and don't use antibiotics that were prescribed for someone else, because we don't know what their infection was, and it might not be the best antibiotic for you.
Well, if someone takes it as prescribed in all the doses, ideally there really should not be leftover antibiotics.
Agreed.
So what happens if they take that round or that course of antibiotics and there's no improvement? So what is the next step after that?
Yeah, so that's something where you would talk to your doctor and they would do some more tests and imaging. They may try to get a culture. So that's when they try to grow whichever germ is growing, and we can see if there's a better antibiotic that could work. It'll require, it may take some time because the bacteria has to grow in our lab, but in certain scenarios, we should be able to see what antibiotic might be better.
So basically we have to take our antibiotics as prescribed for the duration. Don't assume that every time we're sick, it's a bacteria infection causing it. And we want to avoid superbugs. So we avoid getting things like C. diff or other infections that are not being, that don't, that where antibiotics do not respond to the treatment. So other than that, are there any kind of resources that patients can access to read more about good stewardship or to read more about antibiotics? I always say antibiotics saved my life 100 times over. So I know the importance of them, but I also know the importance of not taking them when they're not needed. So how can people educate themselves?
Yeah, that's a great question. I would say always talk to your doctor about what their approach to antibiotics are. If you're prescribed an antibiotic, ask about what the risks are. Make sure you're taking it correctly. And there's some great resources on the CDC website, which I can share, that has some great information on what to do if you're prescribed an antibiotic and how to take them safely.
Okay, we got a nice comment. Jonah DeVera says, excellent information. Thank you, Dr. Tripathi and Dr. Dave. So, if anyone has any questions, they can put them in the comment section of wherever you're watching, and we'll be sure to get them answered in a timely manner. So thank you, Jonah, for watching. And also thank you everyone else for watching. And thank you to Dr. Tripathi and Dr. Dave for joining us and educating us about the proper use of antibiotics. Bye-bye, everyone.
Thank you so much.
Bye. Thank you.